A meeting of the world's top prostate cancer researchers has recommended all men should have a blood test for the disease from the time they're 40. Views vary around the world about the worth of the test, so the Congress, meeting in Melbourne today, sought to arrive at a consensus. Jeff Waters reports.
A simple blood test which can show or predict prostate cancer has caused a big argument here and abroad. In the United States, guidelines recently recommended against anyone having the prostate-specific antigen or PSA test.
I reviewed the evidence for me and decided not to have the test.
Because you don't have risk factors in your family? Or?
I don't have risk factors, and I think within the next decade there's going to be a better test.
The test is available in Australia, but there are fears it leads to too many people having surgery which may not be necessary. The side effects can be severe. But thankfully, that didn't deter Andrew Upson, who had the test and found he had cancer.
My surgeon came in 2 days later, I was still in hospital, and said to me, "Thank goodness you pressed me to have it done now, because your tumour was a T3, which is the most aggressive."
Now the best prostate cancer minds in the world have come together in a country with the highest prostate cancer rate to end the debate.
For instance, I grew up in an era where we didn't have any testing, and the majority of men that I saw with prostate cancer had it spread to their bone.
They've issued a consensus statement encouraging men as young as 40 to have the tests, but they've urged the results should be carefully looked at to decide if treatment is absolutely necessary.
So men now should understand that if they are diagnosed with prostate cancer, very many of them do not need at least urgent treatment for prostate cancer, and they can be safely observed or surveyed.
They say the PSA test should never be used alone as a diagnostic tool. Jeff Waters, ABC News.